Well, Dr. Zaher Sahloul is one of the medical professionals who's been briefing the Security Council. He returned from a Syrian American Medical Society mission to Aleppo at the end of June, and he joins us now. Hi there, Doctor. A very warm welcome to the programme. Tell us what you've been telling the UN about the situation on the ground.
I shared with them what I've seen in the last medical mission and the previous ones. The situation in Aleppo is catastrophic. It's actually beyond description. So I focus on presenting pictures of patients that I've treated when I was in Aleppo and with my colleagues. Children who had, one of them which I presented, Ahmad, 5 years old, who had a spinal cord injury because of barrel bombing, and he was on life support. Unfortunately, one day after I left, he died. I presented the story of a woman who is pregnant in her 3rd month, and she had a barrel bomb. Her 2 children were killed, and her baby also was killed, and she was on life support. So every patient I've seen was a victim of barrel bombing in Aleppo. All of them are civilians. And I visited 7 hospitals in my mission, and every hospital was bombed several times. I mentioned the numbers that in July of this year, 43 attacks happened on healthcare facilities in Syria, which is a record in Syria. And since the beginning of the crisis, we had about 350 attacks on healthcare. In July alone, we had 43. Among them, 15 attacks on hospitals in eastern Aleppo, which is under siege. There's 300,000 people in eastern Aleppo under siege. 85,000 of them are children, 20,000 below age of 2. And they're in a really terrible humanitarian situation. There's shortage of food, baby milk, diesel fuel, sutures for surgeries, antibiotics, blood products. I spoke with the nurse this morning from M2 hospital. Her hospital was bombed 3 times in the last week. And she told me that there is a baby that is waiting death on life support. And they wanted to evacuate that baby. Her name is Shahad. She's 10 years old. She needs a CT scanner, and there's no CAT scan in the whole city of Aleppo for 300,000 people. And she begged me to convey the story to the Security Council. So at least if they cannot have peace and prevent the bomb from falling from the skies, at least they can evacuate this patient and other patients who are waiting death and trapped in the city.
Dr. Sahloul, these humanitarian corridors that are often spoken of, reports we've received say that these corridors don't exist, or the ones that do aren't safe enough for anybody to use them. To your knowledge and what you've seen, do those corridors exist?
I mean, this is a myth that no one inside Aleppo believes. There are no humanitarian corridors. 2 years ago, there was a corridor that opened between East Aleppo, which is controlled by the rebels, and West Aleppo, which is controlled by the government. And in Aleppo, they called this corridor Ma'bar al-Maut, the corridor of death, because every day there were snipers on the government side that were shooting at people who are trying to pass through this corridor. I was in my 2nd medical mission when we received a child after child who were shot at by the snipers. We saw pregnant ladies who were shot at by snipers. So people in Aleppo have a fresh memory of these corridors, and they don't call it humanitarian, they call it corridors of death. In order for a humanitarian corridor to be functional, it has to be both ways. You cannot just force the people out and don't let them in. And also, you have to let humanitarian goods and food and medicine to get into the city according to international humanitarian law. And also, these corridors have to be under the oversight of neutral body, not the Russians or the regime. People do not trust the regime that is bombing their children and bombing their hospitals. It has to be under the oversight of a body like the United Nations or the Arab League or OIC, some body that is trusted by the people. And
Dr.
also the
Sahloul,
Castello Road, which is the only road to...
Dr. Sahloul,
Yes.
I just want to ask you, I mean, we've seen some pictures there, and obviously your testimony is incredibly heartfelt and harrowing. What do you hope that telling these people's stories will achieve?
I mean, I spoke as a physician. I'm a doctor. I'm not a politician. I wanted to share these stories of my patients that I've seen, and my colleagues have been shared. And I wanted to connect to their hearts. I mean, these ambassadors, they have children also, and if they see these stories, hopefully that will move them. And they feel responsible about addressing this humanitarian crisis that is urgent. We're talking about 300,000 people at the brink of starvation if the siege continued. And I think many of the reaction that I've seen indicates that people were affected by what they heard and what they have seen. Hopefully that will move them to do something beyond condemnation and words. People in Syria and us, we're not waiting for condemnation or strong word or finger pointings, frankly. We're waiting for action, and I think the United Nations Security Council has the power to act. They have the power to have real humanitarian corridor, to stop the barrel bombs to fall from the sky, and to have some peace for the children of Aleppo.
And Dr. Sahloul, how is the shortage of medical staff and equipment of medicine helping people who've got long-term conditions? Because it isn't just the bombs falling, of course, it's people's more general health and mental health.
I mean, this is something that definitely is not addressed. The mental health of children, of women, of even medical staff. I mean, doctors are working nonstop. One of the nurses I spoke with today, she's been working 36 hours nonstop. She had no sleep, and she said that she cannot just go home because there's no one else who can take care of the patients. So the mental health has to be addressed, but the most important thing is to provide some level of normalcy to these people, maybe a break from the bombing. For 1 or 2 days, getting them some medicine so they can treat their patients. The worst thing for doctors is that when they know that they have a patient that they can manage and treat and save life, but at the same time they don't have enough medicine or surgery that they can do for that patient. We're talking about only 35 physicians that are serving 300,000 people. We're talking only about 20 or 25 nurses that are serving this huge population. One physician for 8,500 patients. This is very dismal number. And I think the international community can do more to provide medical care to these trapped population, not only by sending them supplies, but they need also to keep the road open so doctors and nurses who want to volunteer and go to Aleppo will have the chance to. I can tell you that there are many of my colleagues, including myself, will be happy to go back to Aleppo to provide medical care and help our colleagues inside the city if we're allowed to.
Dr. Zaher Sahloul, thank you so much for joining us and sharing the stories of the people of Aleppo. Thank you.
Thank you very much.